Hello, my name is Alice Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. How are you doing?
Hi, Allison. Doing great today. We're getting closer to spring, and I think that's lifting everybody's spirits.
Yeah, definitely. Well, let's launch in, and I know that you got a call from a California orthodontist this week asking about pre-procedural mouthwash rinse or mouth rinse. So
Yeah.
what's going on there? Because I've heard about this too, like the role that they can play or can't play.
Yeah. Well, questions come up for the orthodontist and for the orthodontic team, and I get quite a few calls every day and every
Mhm.
week, as you can imagine. And Dr. John Eisinger in California, I had spoken with him over the years a few times and advised him on his sterilization area. And they had a problem that he called me about recently. And he left me a voicemail and he said, Jackie, we're having difficulty getting enough time for these mouth rinses for our patients before their appointment. I'm wondering if you can call me back and offer me any advice.
Yeah.
So prior to calling him back, I thought, I need to do a little bit more research on what's recommended. And
Mhm.
so I went through and reviewed what CDC recommended on pre-procedural mouth rinses. And then after I had the most current information, I called Dr. Eisinger back and I said, well, tell me what you're doing. And he said, well, it's a real challenge for us because we're having our patients come in and rinse for 2 minutes with a 1.5% hydrogen peroxide rinse before we seat them in the chair. And they're having to line up at the sink in the toothbrushing area to do this 2-minute mouth rinse. And we're finding it just becomes a block, a log jam, if you will, to our schedule of getting patients on into the clinic area. And I said, well, let's talk about a couple of things in here. I said, why are you having them rinse for 2 full minutes? Because I can just see, a 9, 10, or 11-year-old child that you give them this foaming hydrogen peroxide mouth
Right.
rinse, and
Yeah.
it's bubbling.
Yeah.
And I go, 2 minutes is a long time to
Yeah.
hold that mouth rinse in your mouth. And he said, well, I read it, somewhere. He says, and he wasn't quite sure. He said, maybe the AAO website. I said, well, when I reviewed the CDC guidance, it didn't give a specific length of time.
Hmm.
There's recommendations for using either 10 milliliters or 20 milliliters, which is a small volume. If you can
Yeah.
see this, one of these little medicine cups like that,
Hmm. Yeah.
that's 10 milliliters. And so that's a small volume. And different product manufacturers, with that mouth rinse, you might want to look at what they recommend as their length of time. But I would think anywhere from maybe 30 seconds to a minute would be long enough. And I think the best recommendation is to give that to the patient in a patient paper cup
Hmm.
and go ahead and have them seated in the chair.
Hmm.
Because once you put the patient in the orthodontic chair, then they're going to take off their mask. They wore their mask into their office. And then you give them that pre-procedural mouth rinse and say, swish this around in your mouth and hold it for as long as you can.
Hmm.
And then spit it out into this paper cup. So that, if you've got a child that can do it, they may swish for 2 minutes or
Right.
1 minute. And during that time, that's when the orthodontic assistant can be setting up for the procedure at the chair side. If the instruments are not already opened in the pouch or the cassette, they can go ahead and do that. And then instruct the patient to spit, expectorate back into the cup. The assistant can take a paper towel, put it down in the cup for that small volume of liquid, 10 milliliters, and the paper towel will absorb the liquid and they can throw it away in the trash.
Okay.
So that protocol completely deletes the patient having to stand there at the toothbrush sink
Mm-hmm.
And in the orthodontic office, and many ortho offices, they have a toothbrush area where they've had 2 or 3 or maybe even 4 sinks side by
Right.
side. So all of
Yeah.
their patients could brush and floss and rinse prior to their appointment.
Mm-hmm.
Um, because having a clean field and not having all that food and debris stuck in the
Right.
braces,
Yeah.
well, that's been safer for a long time, but also we can see, and it's a good time for oral hygiene instruction in addition.
Right. Yeah.
Dr. Eisinger, he said he was so grateful. He said, "Oh, we can manage that. That way we can still get the protection of from doing that pre-procedural mouth rinse that's going to reduce the microbial flora."
Mm-hmm.
And of course, his goal was to reduce the SARS-CoV-2 virus, the virus that causes the COVID-19 infection. However, again, when I researched in CDC, CDC specifically stated that there really is not a control study or
Yeah.
documentation on the efficacy of pre-procedural mouth rinses.
Right.
However, it was recommended by ADA, by the AAO, by CDC.
Mm-hmm.
But CDC puts that disclaimer in there, and CDC specifically said any of the antimicrobial mouth rinses that maybe contain chlorhexidine gluconate. We
Mm-hmm.
don't use that a lot because it stains the teeth brown. Nobody
Okay.
wants brown teeth.
Right.
Cetylpyridium chloride in there. Povidone iodine was another one. Essential oils. All of
Okay.
those were recommended by CDC
Okay.
as potential mouth rinses. So an antimicrobial, again, that has been that's an approved over-the-counter mouth rinse, I think would be an effective and a good strategy to
Mm-hmm.
help reduce the amount of oral microorganisms when we're treating the patient and we're generating those aerosols. So it seems reasonable and an aseptic precaution to take during
Okay.
orthodontic patient care.
Well, and you recommend those types of products as opposed to the diluted hydrogen peroxide, correct?
I did, and the reason, the history. Let's talk about why Dr. Eisinger was using that 1.5% hydrogen peroxide,
Mm-hmm.
or even the 0.5% povidone iodine.
Mm-hmm.
Both of these recommendations came out of the Hospital of Stomatology in China in
Okay.
April of 2020.
Oh,
Just
okay.
as all of the orthodontic offices were closed, an article was published that at the Hospital of Stomatology, where dental patients were treated and orthodontic patients during the very beginning of the COVID-19 infection,
Mm-hmm.
that all of the dental team there wore PPE to prevent the aerosol disease transmission, but they also had their patients rinse with these particular solutions. And during that time, they didn't have any transmission of disease among the dental healthcare providers.
Okay.
So that's what we refer to as an anecdotal. You
Mm-hmm.
know, this is the story. This is what we did in our facility, and this is what we observed. It's
Mm-hmm.
not a control study. It's
Right.
not a laboratory or a scientific, and they didn't actually test any of those chemicals against the SARS-CoV-2 virus. It's
Mm-hmm.
just relating what happened.
Yeah.
And we were so desperate to reopen our offices safely
Mm-hmm.
after closure back in April and May and June that we, you know, as professionals, we were searching for what is going to be effective, what's going to allow us to reopen and provide safe patient care,
Mm-hmm.
that many professional organizations even recommended what had been reported from the Hospital of Stomatology. And
Okay.
now there is some research that is being done because of the need for it.
Right.
And just last week in the Journal of the American Medical Association,
Mm-hmm.
I found a publication that was on research with povidone iodine
Mm-hmm.
as a mouth rinse and a nose spray, and they actually tested it against a SARS family virus to determine is it going to be effective against the SARS-CoV-2 virus.
Right.
And Allison, in this study, now this was done by the University Hospital in Poitiers, France.
Yeah.
So again, it's a medical study with it,
Yeah.
but they had patients who were infected with the SARS-CoV-2 virus, had a high viral load,
Mm-hmm.
in their oral pharynx area. They had them rinse 4 times a day and spray inside their nose with povidone iodine with a 0.5% solution for 5 days.
Mm-hmm.
Can you imagine rinsing 4 times a day for 5 days? And then they tested the viral load for the SARS virus,
Mm-hmm.
and there was no reduction.
Ah, okay.
So here we have a study, if you will,
Mm-hmm.
that has been published. It has been peer reviewed,
Mm-hmm.
and it indicated that the iodine recommended mouth rinses were not effective against the SARS-CoV-2 virus.
Yeah.
So we're going to have more and more. I think there are some studies that are being funded right now.
Right.
There was just an announcement at the University of North Carolina where they're
Mm-hmm.
going to be looking at pre-procedural mouth rinses. So
Right.
there is a need for controlled studies,
Mm-hmm.
scientific evidence. It seems like it would be a logical, good aseptic protocol,
Yeah.
but studies will let us know what's effective and what
Yeah.
isn't.
Um, I know that when we talked, you had mentioned that you kind of caution against using the diluted hydrogen peroxide specifically, just because it's an off-label use.
It really is. Hydrogen peroxide that we buy in that brown bottle over
Yeah.
the counter is designed as an antiseptic for the skin.
Right.
It really is not validated for an oral rinse.
Mm-hmm.
Unlike the mouth rinses that you'll find in the oral hygiene area of your retail store, where you have the fluoride mouth rinses and the essential oil mouth rinses, those are all approved by the FDA and marketed as over-the-counter, safe care products for the
Mm-hmm.
public.
Mm-hmm.
And that was one of my concerns when I talked with Dr. Eisinger. I said, when you start mixing and diluting products in your office, there's always the risk that someone gets in a hurry and forgets to dilute it and maybe gives
Right.
it full strength. Or
Mm-hmm.
what if a child accidentally swallowed some of it and it was full strength?
Yeah.
Worst case scenario, I'm the risk management looking at,
Right.
what's the biggest risk here?
Yeah.
How can we prevent and provide safe care and eliminate that risk with it?
Mm-hmm.
So that was one of my concerns in using it in an off-label manner with that hydrogen peroxide, or mixing any other chemicals that were not designed for oral use or for safety from the FDA
Okay.
with it. Yeah.
Okay. Okay. Well, so now some schools are opening, reopening,
Oh,
and there are going to be more appointments scheduled after school. Now, the recommendation has been to have the patient brush and floss at home.
yeah.
What should the practice do if they've got a patient that comes in who hasn't? What's going to be the guidance or the,
Yeah, well, going back to again when we reopened our practices back in April and May,
yeah.
we were having patients sit in the parking lot and text, and then we'd tell them that it's time to come in.
Yeah.
And always in the instructions prior to their appointment, we told them to brush and floss at home
Mhm.
because the toothbrush area was closed.
Yeah.
That was a risk of cross-contamination, of generating all those splatters and splashes, and the orthodontic office didn't know what the risk was of transmitting a disease there, because that's one time you're going to take off your mask.
Yeah.
So instructions were, please brush and floss at home. Well, now that we're in the infections are going down and the vaccine is here and schools are beginning to reopen, you're going to have more orthodontic patients come for their appointment after school. Now,
Hmm.
as a hygienist and a consultant to orthodontic offices, I know that as soon as a child gets out of school, they're hungry.
Yeah.
They want a snack. Mom very often will have a snack in the car as they're picking up the kids at school to take them, and they'll have their snack on the way to the office, knowing that they could brush and
Mhm.
floss once they get to
Yeah.
the office, because
Right.
you can imagine a mouthful of braces and Oreo cookies. It can be quite a contaminated field, let's say, with it. So the patients may not be able, those after school appointments, they may not be able to go home and brush now. So the orthodontic office is going to have to look at reopening their toothbrush area to accommodate these situations. And I would recommend that you only have one sink at that toothbrush area open at a time. If you
Okay.
have 2 or 3 sinks there, then please in some way cover or put some sort of protective barrier over it. This sink's not to be used. That will prevent from having 2 or 3 people within less than 6 feet of each other with their mask off and brushing and splattering. And then of course you're going to have someone come behind them and sanitize the area before the next patient comes in to brush. So I'd still advise patients to brush and floss prior to coming, but if you have those after school appointments, find a way to manage it. And hopefully this suggestion about doing the pre-procedural mouth rinses while the patient's in the chair will be a time saver and improve the scheduling for the orthodontic team.
Okay. Well, thank you for this helpful information. I think it will really help with the schedule and kind of the patient flow. So we will be back next week for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website, orthodonticproductsonline.com. Until next time, take care and stay safe.